People come with chest pain, severe chest pain. We do everything. We image the heart, we do an echocardiogram, electrocardiogram, and all the blood tests. The heart is normal. And they are crying of chest pain. And they believe the heart has a problem. In that case, if they are able to remove stress out of the equation, they will get well. And I've given an example of myself in this book.
Take us through the internal structure of how I, living my life, the connection, like, is it my lived experiences? One of the most interesting examples was someone may have never seen a snake, but you're afraid of a snake somehow because an ancestor of yours may have had a bad experience.
Absolutely.
So what is the selection of what gets to be carried on to my child, and how is this decided?
Absolutely. So, for example, I will start with like fear. Like you mentioned, fear of snakes.
Yes. A quick one kabla tuzame ndani ya conversation. This is a special message to all seekers who are greener pastures, especially if you believe in the American dream. If you have ever considered moving from Africa to the United States of America as a professional, then this message is for you. Now, for the past 8 years, the International Scholars Program has facilitated the financing and migration of high-achieving scholars to the US. The program has been expanded to support highly skilled professionals through its EB2 NIW pathway that allows you to pursue permanent residency without a job offer or company sponsorship. So, if you're looking for a trusted partner to guide your journey to America, ISP offers a proven legal pathway that can also accommodate your family. Yes, there's many ways to get to the United States, but ISP has mastered one of the most effective routes to help you relocate with dignity and strategy. Alafu sasa, nani alisema ukienda US lazima uanze from scratch? As a highly skilled professional, ISP's approach is designed to help you transfer your expertise across borders. In simple terms, if you leave Kenya as a professional, you don't have to start over in survival mode jobs as you figure things out. Work with verified professionals, work with a system that understands your value. You can get in touch with ISP using the contact details on your screen. Consider yourself plugged. In my last conversation with our guest for this episode, nilisema once I lay my hands on the book, Escort in Chief, we are gonna set up a conversation, and I'm very, very glad that Dr. Bundi Karau has managed to make it to Nairobi specifically so that we can share good vibes. Na wadau, karibu sana Doc.
Thank you, Dr. Kingoria.
A man of many fasts. Tuseme niliona at the event yenye tulimit kwa the book launch ya Dr. Stanley Aruyaru, uliitwa Kenya 1 2002. Number one top student in KCSE, and I would be curious, I never asked you this. Kwa KCSE number one, in KCP, which comes before that, performance ilikuwaje?
I did my KCP in the year 1998.
Yes.
So performance was not bad, but it was also not very good. I mean, I was nowhere in the ranking. Let me just say that.
You are nowhere in the ranking? In the ranking,
yes.
What changed between 1998 and 2002?
I think the difference is, first of all, where I went for primary school.
Okay.
I mean, we had almost no books. We were deep in the village.
Yes.
We were trying to work hard, but we didn't know much, of what existed, the possibilities that existed out there.
Okay.
So what changed is the exposure. I went to a school with a tradition, with a history. Even if it had sunk by the time I attended Kanyakina High School, the facilities were there, the teachers were there. So when that opportunity came, I think, and I put in some hard work, we got the results. That's the difference.
Interesting. I'm a big fan of hypothesis, sana. So when you mentioned comparative performance between a school in the village and the national schools, for example, my mind rushed to, what do you think the scenario looks like? Had you gotten a chance to go to Alliance High School for your secondary school?
I've also thought about it. Thinking about it, I think I may not have done as well.
Really?
Yes. Maybe the competitive environment
Yes.
would have somehow brought some stress, anxiety,
Yes.
and maybe the performance would have been lower. That's what I always think about. Yeah?
Okay.
That sometimes competition is good, sometimes it's not. There are some people who might thrive well where they are being pushed. The others, when the push comes, they tend to stumble. I think I might have fallen in the second category. I think it was kind of some coincidence of circumstances that I found myself in a school where I had almost no competition.
You had almost no competition.
Yes.
Hey.
Yes.
So now I was in a school this week, Presbyterian school in Presbyterian Shakaina school in Ruiru, speaking to young students on invitations by my friend. And there's something I picked up. I have this assumption that each and every student has a chance at academic excellence, right?
That's
Just getting certain factors right.
Yes.
Number one, how you get introduced to the subject. Number two, your personal, like I gave them an example of proper sleep and the relationship between the hippocampus, the part of the brain that absorbs and stores information, and absorbing what they learn in class.
Yes.
Was I accurate? Now, from a medical perspective.
You are accurate. Two ways to look at it. Yeah.
Yes.
When children are young, like in primary school, some of them can succeed by just being pushed, as long as they have the ability to retain information.
Okay.
The brain areas for information processing, storage, and retrieval are working.
Yes.
They can be pushed to success. But there's another scenario here, whereby you're in a place where you're not being pushed. It depends on you realizing or discovering yourself. So that discovery, how early it comes, is very important. Some discover themselves at 10 years, others at 12, others even before 18 years. They don't know where they are or what they want.
Oh, for real?
Yes. So you see somebody who has been joking around. In Form 3, they pick up and start working hard and succeed.
Yes.
Somebody else at 10 years, they already knew where they wanted to go, start working hard. Others, depending on where you go to school, you're in a school where failure is not condoned at all.
Yes,
you are pushed whether you like it or not. All those are circumstances that will determine success. Yes.
And so now this now is bordering lack vibes. Like, ani bahati ya mtu. Because when you look at some students may need to be pushed for them to perform.
Absolutely.
Others, if you push them, you actually mess up with them kabisa and you destroy their potential.
Yes.
So how would one tell? How would let's say a parent watching, how would they tell that this is the right strategy to help their kid achieve their maximum potential?
So this I think one of the failures of education as a whole, that we take all children to be the same, or all learners to be the same.
Yes.
Whereas we are dealing with with different personalities. Yeah.
Yes.
Different personalities, different genetics. Different genetics, different personalities. There are those when they are instructed a lot, they get lost. There are those without instruction, they will not perform. There are those who would rather be alone with minimal, contact with the teacher, go to the corner and read on their own. All those are personalities, and it has to be cooperation between the parent or the guardian and the teacher to know where your learner lies in that continuum. And that's where personalized education, matters. And I've seen even some parents do homeschooling when they realize that they are the only ones who can understand their children. The initial years, maybe up to class 8, they homeschool their children. It's because of that realization. Yes.
What kind of a student were you in primary and in secondary school?
I would say I was a student who was driven from deep within me. I actually desired minimal contact with the teacher.
Okay. You did not like you worked under minimum supervision.
I worked under minimum supervision. Even now, I serve in some boards. Yeah? One of them, I have been in a board of a national school. And every time I go there, I ask them, how many hours do you give students to be alone? Then you realize they have classes in the morning before a breakfast.
Yes. Then
in the evening, after supper, with the teacher. Then the whole weekends, they are being taught. I would not thrive in that environment. Personally, I know I would not have thrived. I like the teacher comes, introduces the concept, leaves me to go and research for more information and read on my own. I'm that kind of a student.
Yes. Dr. Bundi is a neurologist. Unajua saa ingine I get mixed up between neurologist and neuroscientist. Yeah? And our conversation is happening at the Pullman Hotel
in Upper Hill, where they are proving that the best business meetings don't actually happen in a meeting room. I love being here because the space is built around workspitality. It's where high-end service meets a truly functional, creative workspace. If you're looking for a spot in Nairobi that swaps corporate grey for something more inspiring, this is definitely it.
When I was reading this book,
Yes.
nikaona very strong statements kama the job of a physician ama a doctor is not to prevent death. Alafu tena nikaona, and it's very well qualified. Alafu nikaona something else along the line, and this was interesting. Ati when you're treating, you're not looking at just dealing with the condition, you are also looking at the after. And there's a particular example that I know most men, as they read through this book, they will be concerned about. Ati, unaenda treat blood pressure, you sort the blood pressure, na uache mtu na erectile dysfunction. I was like, oh Lord, uko ni wapi tumeenda bana. So inamaanisha, when you're treating someone, that's actually true. Like, kuna button ukifinya, when treating someone, atapona, lakini transformer imeenda. Kukata stima kwa pole.
Yes.
Oh Lord, what's that about?
Because most of the antihypertensives or drugs for blood pressure affect the balance of hormones, testosterone and some other hormones, and the blood flow to the reproductive organs. So they cause erectile dysfunction. So then when treating these patients, you've got to look at the other side of their life. It's not only blood pressure as a number. It's a person as a whole. What makes a person as a whole. So then when you are selecting drugs, you know that if I give this drug, it's very effective in lowering blood pressure, but it will cause these complications. What does that mean for life? Does the person will live a holistic life when they are like that? Those are the questions a physician should ask themselves. Yeah.
Oh,
yes.
Really?
Yes.
So it's not just that he's solving the problem, it's solving the problem plus any other outcome that may result to other problems.
And making life bearable. Making life bearable, yes.
Making life bearable.
Yes.
And the job of a physician or a doctor is not to prevent death. That's a very deep statement.
It's not. And this I know is a philosophical, statement.
Yes.
But if the job of a physician is to prevent death, then we fail all the time, because whether we want it or not, people will die.
Yes.
They'll die of old age, a combination of illnesses, even when you've done your best. So to me, when I look at people aging and they reach a point there is nothing you can do, I realize that's not my work as a physician. It's not to prevent death. It's to make sure that when death comes, it comes at the right time.
When it comes at the right time.
Yes.
It will come, but it should come at the right time.
Yes. Like, take this. Yeah?
Yes.
If somebody has a cancer of the brain, some cancers, like, let me give you an example. There's glioblastoma multiforme, GBM. The median survival is 6 months when you are diagnosed with that condition. Then as a physician, you should ensure that the patient at least reaches 6 months. But death will come either way. So let death come at the right time. Okay? And right time means, kind of a population average. And what research shows in a population study, research shows that this condition within 6 months, the person will be dead. Then it would be bad if he died at 1 month. Right?
Yes. But there are times, ukisema median, yes, the patient should get to 6 months, right? That's success.
Yes.
But there are patients who defy norms.
Absolutely. There are patients who will, even years to come, they'll be surviving. Even in a condition we know survival rates are very low. That happens because also people are different.
Yes.
There is no one person who is the same as the other.
You run away from breaking bad news. So when you find a patient with such a condition, have you developed the skill to break bad news as of now?
I still find it difficult, but I do break them. part of the reason I want to teach myself to break bad news is when you are now a specialist, like I am, I'm a physician, I'm a neurologist. Most of the times patients will be sent to me, sometimes even with the only reason is for me to break the news. You can see your juniors, they already know the problem, but they say, go, that doctor has a solution. So what they want is me to synthesize the situation for the patient.
Yes.
Sometimes I also look at whoever is, seated across me. You look at the family, you look at the person, and you see, you weigh, should I break the news or not? You can look at somebody who is dying and look at the confidence the relatives have and they have, and realize the only way is to tell them the truth. So then other patients, they already know. They have, they are learned, they know what's happening. They are just waiting for somebody to confirm so. So over time, I have developed that thick skin. But what I do, I don't break bad news like immediately. It's gradual. I can send you away, ask you to come in a week, maybe even give you some assignment to read. And we go slow, step by step, slowly. And with time, eventually I will have told you, this is what is happening. These are the outcomes. And this is what we can do. This is what we can't do. Yes.
I'd like us to poke into that kidogo, but let's go back to like this for me stems into something.
Yes.
Kuna kitu tulikuwa tunaongea offset inaitwa science of happiness.
Yes.
And the how like management of like well-being.
Yes.
Right?
Yes.
And I'll throw it to a common phrase people throw around because nataka tuingie kwa hiyo science of happiness because I was very interested in your submissions on that.
Yes.
So people say ati money cannot make you happy. And the explanation you give qualifies it in a way that I don't think it has been put better. So let me ask you an unfair question, and then we break it down from what happiness really is. The unfair question is, why can't money make someone happy?
Because money gives you one form of happiness. It's not the complete story. It's what it does, it kind of gives you a kick. And that's what I was calling the dopamine surge.
Yes.
It elevates the dopamine levels in the brain. And that's any happiness stemming out of dopamine is short-lived. After that, you ask yourself, what next?
Any happiness stepping out of dopamine is short-lived.
Short-lived, yes. And that's what we call hedonism or hedonistic happiness.
And sasa now I knew you would explain it very well.
Yes.
Na tutaenda nayo pole because that answers the big question. Yeah, why do people who love money always look for more money when they get the money they were looking for?
Yes, because they get into the dopamine cycle.
Okay.
Dopamine surges and it has a very short half-life. So if you have been craving for $1 million and you touch $1 million, within a few minutes or maximum hours, you'll be feeling the same way you used to feel before. And that's the same for most other ambitions we harbor in our lives.
Okay.
You say, when I step into a plane, I'll be the happiest. You step. Like me, when I stepped into a plane in 2007 to go to Mombasa, I did not sleep that night because it had been my ambition to get into a plane.
Yes.
But once the plane cruised and started going up in the air, already there was nothing about it. Now I was looking up to the next, maybe being in a rocket or being in a train. So dopamine gives you that, once it goes down, it leaves you a little, even empty and yearning for more. So you get into a kind of a dopamine cycle. Okay. You are looking for the next dopamine kick. Okay. And that is even the problem with addiction. Addiction also does the same.
There's a high. So it means, let's say, for example, you don't have money. And then you find the money.
Yes.
Like, let's say you've never touched $1 million.
Yes.
Then you touch $1 million for the first time.
Yes.
And then it stops exciting you.
Yes.
So this $1 million becomes, it's not enough for your dopamine again.
No. Now there will be another goal to give another dopamine surge. And that goal could be more money.
Okay.
Yes.
And if I caught what you explained to me correctly, that the bananas are good for this kind of happiness, like your kick. Bananas are good for the long-term happiness.
No, bananas have a chemical called serotonin.
Yes.
Serotonin is the chemical that mediates long-term happiness or internal happiness that we call eudaimonia.
So eudaimonia is the other one.
Is the other one, yes.
Oh, I was confused. I thought that sasa if bananas can bring the dopamine kick, if I don't have money, I can eat a banana.
It will not. But some chemicals or some substances increase dopamine levels.
And is it the same? Let's say someone doesn't have money, right?
Yes.
And that means it's dopamine.
Yes.
And then they use something that increases their dopamine level.
Yes.
Will they forego the money?
They'll be happy. They'll be happy for the time being until the dopamine goes down, and then they feel empty. I'll give you an example. Amphetamines, and you know Mobuka and Mira has amphetamines. Yeah? They increase dopamine levels. So when somebody has taken that up to a certain level, a certain dose of Mogoka,
yes,
they'll be feeling on top of the world. I mean, they have achieved.
Yes.
Whatever was bothering them no longer bothers them until, the half-life is over.
Yes,
they go back to where they are. So
Yes,
they'll be looking forward to the next kick. Yes. And that's why it becomes a cycle.
Thank you.
Yes.
And I think that's what breeds addiction, because your system now gets used to it.
Absolutely. And addiction and tolerance. So the doses you are taking no longer produce the same kick. So you've got to up the dose.
Okay.
Yes.
So ndio kierere isifanye niharibu the explanation that you gave. Please break down the difference for us between short-term and long-term happiness.
Yes. So short-term happiness is mostly born out of ambition or the things we wish we had. Yeah? And when we get them, we get that dopamine. They feel good. It's kind of orgasmic happiness. Yeah. But there's this low happiness that is born out of meaning. Like you say, for example, my life is about helping the society.
Yes.
My life is about bringing forth artists.
Meaning.
Even that is meaning in life.
Yes.
And most of the times you realize that eudaimonia is not about excitement. It's about meaning, profound meaning, and depth in life, fulfillment. And that's the one that is usually served by serotonin. And you realize when somebody is depressed, it's not about dopamine. It's about serotonin.
Oh.
Yes. They say, I have no meaning in life. Whatever long-term meaning, I look ahead, I can see doom. Somebody who is depressed, even if you come and give them money, it will not make them better.
Oh.
Yes.
I like quoting a meme. Yeah, there's kuna kuanga na a dog, very miserable kwa kiti, and the caption has always been, ati, when people think you are sick, and then your real problem is money. So this is like a typical example of someone who's going through a hard time. Yes. Are you saying at some point, if your issue is meaning the long term, even if you get that money, it doesn't help?
It does not help. If somebody is depressed, you realize even if you give them money, the depression will not go away because it's a chemical issue. It's a chemical imbalance in the brain. Yes. And something else I would like to say is that how the balance of the chemicals is determined by many things, by past experiences, but more importantly also by genetics.
Genetics?
Yes.
So are you saying that some people are genetically predestined for depression?
They are genetically predisposed for depression. You even
predisposed,
see
not
predisposed, not predestined.
Okay.
They are genetically predisposed, and depression runs in families, just like any other mood and psychotic disorders. You must have observed in your observations come across a group of people, maybe they are brothers, who look at life the same way. When they are stressed, they look the same. Small things stress them.
Yes.
One is taking antidepressants, the other one is taking, anxiety medications. It's because these chemicals, they amount the receptors. Chemical mediators in the brain work through receptors. How many receptors are there? Could be genetically influenced. Very, very open now that it could be determined by genetics. But you see, this is a predisposition. Now the environment becomes a trigger. It's like having a tiger and then you throw a matchbox into it. Yes.
So hii kitu ya kuna watu wanakamati wa roho mbaya, like people who always have who are always in a bad mood.
Yes.
They were born like that. Yes. Chances are. Can something be done? Is it possible? Or the solutions are just cosmetic?
Something can be done. And that is the whole business of cognitive behavioral therapy and logotherapy. In fact, one of my favorite neurologists is the one who founded this branch of psychology known as logotherapy. logotherapy. Logotherapy means to make people understand their meaning, why they exist. And he breaks it down into three. That you find meaning 3 ways. There are many approaches, but 3 ways. 1, by working. Work gives meaning. 2, by loving. When you love somebody or something, it gives meaning. And then by being courageous in difficult circumstances. That's all Viktor Frankl used to teach. Even now, the Vienna School of Logotherapy exists. And so whoever is counseling, whether the psychologist or the doctor, leads you or chaperones you to look for meaning in those 3 things. And you see somebody has depression, they are told, why don't you buy a puppy? Do you love dogs? And so going home to that dog becomes gives you meaning. I'm taking care of something. Or I'm taking care of somebody.
But a dog has a limited lifespan. If the dog gives you company for 12 years, the average lifespan of a dog, until you will be depressed pro max.
Yeah,
if it
but
dies.
you see, if you hand 12 years to somebody who is battling depression here, within the 12 years, most likely, they will have graduated, they can get another dog. Basically, we are giving them a sense of belonging and a sense of mattering, being needed. Basically, that's all. That the dog is just a medium of mattering.
Okay.
Others, you see them adopting kids, right?
Yes.
You adopt, your children flew away and you're depressed, you adopt. And that gives you a meaning. I'm a parent, I have a child in school, I'm trying to bring forth someone. That's what logotherapy is about.
Okay.
Yes.
So now, I'll tie this. We tie it. So kuna hiyo ya eudaimonia. Eudaimonia is the long term happiness, meaning. Hedonism is the short term happiness, the dopamine kick. Hiyo tuko sawa. So now, again, I'll quote Jonathan Hoyt. He gives an example of a study that was done between a middle-aged white man and an older black woman. These are 2 people who, in the American setting, experience life differently.
Absolutely.
Right? So the middle-aged, like the 25 to 28-year-old white male, you would see like the environment would favor them. They have a good job. They are making money. They are single. They don't have a wife. Wako tu hivo, unhealthy. And then the lady is battling a chronic illness, kama diabetes, and inconsistent medication and in pain. But the difference between her and the white male is that she goes to church, she has family around her, and as an interesting support system around her. And you find that her happiness levels are relatively higher than the white male of a middle age. What's going on there?
I will again go back to the father of logotherapy, who says that when you have the why of living, you can tolerate any how. It's not about it's not about pain. It's not about scarcity. As long as you have a reason to live, then any conditions you can tolerate. And he gives a good example of him. He actually himself was a Jew. He was picked from Vienna. He was a doctor by that time, together with his wife, his parents, his brothers and sisters, and taken to Auschwitz concentration camp, where his wife died, and parents and sisters and brothers. But he observed one thing, that those guys who had a meaning in life, my family, I would like to see the 10th birthday of my child. They actually survived the freezing temperatures. There's something you look forward to. But the guys who lost all hope, even without being executed, because the Nazis were killing people left, right, and center, they started withering away until they died. Some of them would start by feeling weak, feeling pain all over the body. They would then refuse to eat, and you would watch them literally die. That happens even today. When you know the reason for living, when you think you don't matter anymore, then you know very well there can be no happiness.
Is this why the Bible says that life and death are in the power of the tongue? And in this case, we would say in what you believe in.
Absolutely. And in what you believe in and how you think the world perceives you. I can wake up one day and think I'm useless in the world. Okay. I go and treat patients that I'm useless, right? And there will be enough reasons to confirm indeed I'm useless. But I can wake up and say, I'm useful. Whatever small I do in my corner, I'm useful. Whatever small you do in your corner, you are useful.
Yes.
And even if you meet discouragements along the way, as long as you have internalized that you are useful, then those discouragements will not make you stubborn, right? That's entirely different. So you see somebody saying, I'm useless, right? Absolutely. Okay, you would say philosophically, nobody is useless, but being useful or useless is what actually you have told you yourself. Who says you are needed in church? It's you who says. Even if people tell you, or they don't tell you, it's you who says and believes you are needed in church.
Yes.
Or in your church group, or in your chama. It is you who says, I am needed there. I'm part and parcel of this. I matter, right?
Yes.
You can as well tell yourself you don't matter, and actually you won't.
Yes.
You won't matter.
Does this mean positive psychology actually works?
Absolutely, it does. It does.
So what's the relationship, if you can break it down for us? I've interacted with another idea, the direct link between stress and illnesses. So Ebu, in your studies, because you're well read, in your studies, for someone watching, what's the relationship between kukua na stress and negative vibes and illnesses? As in, by the way, this disease can directly be linked to your state of mind.
Absolutely. Even without going to the brain, stress alone modulates the immunity in a way. So stress alone can cause to repeated infections. There are people, when they are stressed, they get flu, they get coughs and sore throats. That's because the immunity has gone down.
It's not until you touch something and got sick.
No. Just go to some universities. When we were doing medical school, some guys used to get stressed, then they start coughing, they get running nose, they get a fever, because the immunity has gone down. Others will get many conditions where the body ordinarily would fight the infection. That infection finds its way into their bodies. But again, there is something in neurology called central sensitization. The sensory information you get from the environment goes through some gates. We call it the sensory gating theory.
Yes.
So somebody can come and sit on my head, but whether I feel pain and suffering depends on my perception of what is sitting on my head. If it is my wife, I'll actually be feeling nice.
Yes.
But if it's my enemy, I'll be feeling a lot of pain. That is sensory gating. So sensory sensitization means when you are stressed, the part of the brain that modulates pain amplifies pain. I have seen people come to my place with a small wound on the finger, but they are crying. No painkiller can. It is the brain that has amplified, and that happens a lot in stress situations. When we deal with headaches, migraine, irritable bowel, joint pains, when psychology enters there, that condition becomes very difficult to manage. Yes, because of that central sensitization. So the pain that ordinarily you would work with, you can be feeling some discomfort and you're here working, right? Somebody with this stress, that pain becomes amplified like 5 times. So they will not wake up. Yes.
So how can that be managed without tricking yourself that there is ignoring and then there is shifting attention?
Absolutely, yes.
How do you manage without pretending that unajua kuna one of my classmates in primary school was abled differently. So he told us that he was once taken to a crusade where people were being prayed for, and he believed he would walk. But then after, he was told that he did not believe enough that he could walk. Then, when I think about that, my mind goes to, he said that he really believed that he was going to walk. So in his mind, he really believed. And the Bible tells us that faith, the size of a grain, can move a mountain, okay?
Yes.
But the interpretation of that may be different. But also this takes us to the realm of when you can convince yourself it's a small thing, right? And you really believe it, and you can pretend it's a small thing. Those are 2 different things.
Absolutely different.
How do you manage perspective?
2 things. One is structural deformities. If you have a structural deformity, it doesn't matter how much you believe. You have it. If you don't have this finger, okay, you don't have it, okay? But there's another group of disorders we call functional disorders. Functional disorders. And when we sit as physicians and neurologists, a big percentage of the disorders we see are functional.
Functional meaning?
Meaning there's no structural problem.
Yes,
it has to do
yes.
with the way the body is wired
Yes,
and
yes,
the way
yes.
the body is responding to some disorder.
Yes, yes,
People
yes.
come with chest pain, severe chest pain. We do everything. We image the heart, we do an echocardiogram, electrocardiogram, and all the blood tests. The heart is normal. And they are crying of chest pain. And they believe the heart has a problem. In that case, if they are able to remove stress out of the equation, they will get well. And I've given an example of myself in this book.
Yes.
I think you've read about my, my toe. That was purely, a functional disorder. Purely a functional disorder. And sometimes comes to you as the individual actually coming to that realization. Us as doctors, we point, but most people, from my experience, never believe that it is a function, it's a functional or psychological problem. I get people with bloating, diarrhea, constipation, what we call irritable bowel. And I want to ask them, do you know what triggers this? Oh, it's some food. Oh, when I take tea, when I take chocolate, when I take milk. And I want to push them to hear them telling me that this comes mostly when I'm stressed. And most of them will not admit that. When you admit that realization, you're in the process of healing. Yes.
So, are there people who die out of functional disorders?
Absolutely.
Oh, Lord.
Yes. There are people who die out of functional disorders, yes.
There's nothing wrong with you structurally. You have no infection.
Yes.
It's just how you manage your stress.
And that is actually what I was telling you about logotherapy. By observation, guys would feel very sick, stop eating, the physical body becomes weak. So the two now combine, a functional disorder plus a physical disorder. That combination is lethal. It can actually lead to death. And that's why there's a theory that actually people, like when people are aging, they die when they want. And I proved that because when Mandela was dying,
When who?
Nelson Mandela.
Yes.
I think he died when he wanted. That is my belief. I also proved that with my grandmother. She grew old in our eyes. Then one day she said, I don't want to live anymore. So you give her food, she throws it away, okay? So this belief that her life is done, coupled with not eating, coupled with a few other frailties, is equal to death.
My grandmother also, and I'm inclined to agree with you, I'm tempted to agree with you on that, because my grandmother at some point, I remember a statement she made. She has done her part in this life. She's waiting for death to come and collect her.
Yes.
That for me was scary, and I was like, hey, what level of liberation do you get to?
Yes.
But when you say people die at old age, people die when they want, there's something in this book very interesting. I've held very radical beliefs about marriage based on what the society is nowadays. But then in Escort in Chief, you say that you have observed that men who are not married at some point suffer very much, and it's directly to being unmarried, and they actually die early.
That is true.
Because of not being married.
Because of not being married. And just look around. Even the married men, on average, women live longer. On average, they integrate better with the society. If you look at the widowers and widows and look at how they live, it's totally different. Women adapt to situations better. I mean, we might want to say we are the same as women, but we are not. A man is different from a woman, right?
Okay.
Almost roughly, all the reproductive organs are different. So how can you say we are the same? The hormones that influence even our brains when they are developing in utero before birth are different, completely different. The hormone testosterone, which has receptors in the brain, in muscle and in bones, is very high in men. It's low in ladies. The hormone estrogen, which influences femininity, is very high in women. And it has receptors in the brain, in the skin, in the muscles, in the bones, everywhere. So we are different. We are humans. We are members of one species called Homo sapiens. But in that regard, we are different. The same way, we are not the same as white people. How would we be white the same, and they are white and we are black? At least there are some genes that code for melanin that we have more than them.
But the difference between white and black, and it's an interesting thing that when you say that, I've seen other areas that in areas that matter, we are the same. IQ, especially IQ, and that's one area that matters. Right?
I know my thoughts on this can be very radical, but allow me to...
Please, we are a platform of open minds.
Yes. You know, our ethos as black people, if you compare them to the Asians or the Arabs, for example, and the whites, the Caucasians, they are totally different. Totally
Ethos.
different. You know, what makes us humans, they are totally different. And I tend to believe that this is due to genetics. I'll give you an example.
Please.
The whites came from London and came here, right? And landed here before the end of the 1800s to the early 1900s.
Yes.
And they came and they tamed us and colonized us. Came with their language and religion. Would you not wonder why nobody came from Kenya and went to London to colonize them?
I think the counter for that would be
Yes.
England, by being in a place where water transport it was possible to develop water transport, the exploration over time was possible. And when they moved to the ability to move in different places based on their geographical location allowed them to collect technology from, let's say, India, knowledge from China, and combining that, they were able to get superior weapons. And that made it possible very many years later for them to come to Kenya. And na hiyo, like the experience over time. Kenya kidogo, inland, utatoka inland kwenda kutengeneza nini wapi.
But there are communities living along the coast. Even the Merus, we have been sent to have lived in Lamu.
But the inland rivers that would allow for water transport sana, and water transport actually to date is still the cheapest. And air transport is safer, but water transport is the cheapest.
That's true.
So I think over time, cumulatively and compounded, hiyo kutangulia technology made it possible to control, to come to Kenya and control Africa. And that would explain why, and the same strategy, colonialism that they used in Kenya was used in South America, North America, because they came up with a strategy, watu kidogo, PR, sindio, and then you control the people. And that's how they conquered the Inca Empire. It's a very interesting story that like 120 people conquered an empire, ikona army ya 100,000. Strategy. Why? Ni tabia walikuwa wamezoea, like kwenda kutafuta.
If you believe that behavior is a product of both genetics and environment, then you see what I mean. I'll give you a counter example. Australia was a black colony made of aborigines, right?
It was.
The same Britons went there and colonized, decimated the aborigines. How comes the aborigines, Australia is an island, did not leave and go to Japan or go to England and colonize them instead? Yet they also lived or the Madagascars. How comes they did not leave Madagascar and they say, beyond this ocean, there might be new lands. Let's go and conquer. Maybe the Madagascars would have left and conquered us, or conquered Zimbabwe and South Africa, fellow blacks. But all of us waited to be conquered by guys from very far away.
Because they were looking for wealth. Hata when it's interesting, ukitafuta history ya colonialism, ilikuwa the watu wa huko, wenye walikuwa tired of like the system huko, they were told, hey wadau, there is land huko that is free. Let's go set up another Britain there. So when they come here, in fact, it was a scam. To a great extent, like niaji, there's land there, they were investors from huko. Ni kama sahi when ukisikia Mars, they found life on Mars, you have money, you can buy land on Mars. Mimi nimechoka na hii dunia naenda.
And you know the same thing is happening now. As we are more preoccupied with personal accumulation,
yes,
a leader in Kenya or in Africa is preoccupied with accumulation. And the next few years,
yes,
some guys somewhere are thinking of 100 years to come.
Yes.
And Museveni once gave a very poignant statement.
Yes.
He said, Vasco da Gama appeared in Mombasa in 1498. Okay?
Yes.
There used to be blacks and, these were Swahili used to come inland and they said, we have seen a white man. But they continued around. They never did anything until in 1870s, they came to Uganda and found Kabaka Mutesa. That is almost 500 years.
Yes.
What were the Ugandans doing? The Bugandans, what were they doing in 500 years? And he said, these point. Guys are going to Mars. They're going to the moon. And they are throwing satellites into space as we deal with common issues. Exactly. Then next they'll be looking at us from there.
And do you know why I would dispute that the white people are genetically superior? When the Africans, say in Kenya, for example, were exposed to the knowledge the white people had between 1905 to 1926, around this area, trouble started brewing. And anyone who was exposed to knowledge, there were more and more concessions in the Lancaster House Conference and towards independence. And we won because people are exposed to the same knowledge. It did not take the 500 years for people to think like the white people. It was exposure to the same knowledge, right? In a very short record time. So they cannot be superior.
I wouldn't say they are superior. My contention is that they are different.
They are different.
What we think is important,
yes,
versus what they think is important are two different things. Only that what they think is important ends up being more overwhelming than what we think is important.
Okay.
The real African, myself included, we are more focused on intangible spiritual things, okay? Our ancestors and the past. And these are the guys that are focused on a future which has to be achieved against all odds. It doesn't matter who they step on. And then legacies. They are also, they think about legacies. Simple. That's the difference between us.
Thank you. And do you know, if not for exposure to knowledge, you would also be obsessed with the same things the ordinary African is exposed to?
Absolutely, yes.
So the difference is knowledge.
My problem is how comes these guys were the generators of knowledge? Where was our knowledge? Where did we come from? How did we come to populate Kenya? Which knowledge brought us up? Right? That's my difference. Why those differences? We are told, the blacks might have immigrated from Egypt.
Yes.
Egypt, is the cradle of writing. Where are our writings? Who was my 7th great-grandfather? How did he live? See, those are things that we've got to be asking.
Some of African knowledge was stolen. In fact, there has been dispute that some of the discoveries that are credited to Western civilization were actually borrowed from Africa. And when it comes to the conquering of empires, if you study the history of conquests kidogo, you find that when they found civilizations which were actually more superior than the Westerns, they decimated that. And when not only in Africa, even in other areas, like the conquistadors, if we can call them that, I hope I got that correctly, they will come, whatever ilikuwa, they replace that with theirs. Sindio?
Yes.
And so on and so forth.
That there was some form of aggression.
Yes. There was some form of aggression.
And I believe aggression is also a genetic aspect.
Aggression is a genetic aspect.
Absolutely.
I agree with you on that, Pia. Yes. But we can still go back to where by exposure to knowledge, you are better than someone in the Western countries who has not even been exposed to the same knowledge. So would you say it's a general thing, ama it's an individual, it varies from individual to individual in a different culture?
There's something we call epigenetics. That is how the environment kind of percolates into genetics and even eventually gets passed from one generation to the other.
Yes.
These guys have practiced some kind of, they have earned some form of practices and beliefs which have become genetic to them. You see a group of white students coming over and you look at their belief, they are more confident, they believe they are better than a professor in Africa. That's because the environment they have grown in for a long time has gone into their minds. It has become part of the genetics, and now it is being passed from, generation to generation. The same way they would say that giraffes had a short neck, but because of going to pick whatever leaves, their browsers, the neck lengthened. So that was kind of evolution, right? It was environment getting into behavior. They have to stretch the neck, the behavior getting into the genes, and the genes being propagated.
Okay.
We propagate, like, let me give you an example. You see the chaos, and I'm sorry to mention this, you see the chaos in the transport sector, like the border sector, for example, because I've written about it in the recently. We cannot, if we have that chaos, don't you think with time we'll think that chaos are normal?
That's true. That's true.
Don't you think then, having normalized chaos, it can actually go into our genes, and the children we reproduce will think that this is how humans are?
That's a good topic.
And a gene can be isolated for that?
Thank you. That's a good place. Epigenetics is a good place to start. Yes. So Ebu, take us through the internal structure of how I, living my life, the connection. Yes. I'll tie this to, let's say, a sperm cell carries, it was mind-blowing to learn that it carries 100 GB of data. What data is selected for storage to be passed to the next generation?
Absolutely.
And where is it collected? Like, is it my lived experiences? One of the most interesting examples was someone may have never seen a snake, but you're afraid of a snake somehow because an ancestor of yours may have had a bad experience.
Absolutely.
So what is the selection of what gets to be carried on to my child, and how is this decided?
Absolutely. So, for example, I will start with like fear. Like you mentioned, fear of snakes.
Yes.
An ancestor maybe was bitten by a snake and died. The people around that ancestor became very fearful of snakes, right? That got into their system as a belief and kind of directed their actions. It is possible that that fear eventually gets transmitted to genes. That's where epigenetics comes into place.
Yes, so break that down for us.
Yes, absolutely.
Yes.
Because what happens is that genes do change. Our genetic makeup mutates depending on the environment. And the environment are both tangible and intangible experiences. So this fear, it could be wired into the genome. Highly possible, yes. And so the other generation, even who have never seen snakes, they see it and they run away. And they run away. So that's, even animal experiments have shown that.
So does this mean all your sperms are cowards, it is the coward sperm that fertilizes the egg? Or there is a balance?
It's the human genome. The whole human genome which has been sequenced. You see, what happens, that what the sperm just basically carries are chromosomes, 23 chromosomes, and the ovum 23, they join to form one cell. That cell carries the human genome. It accounts for everything about life, from your brain to your eyes, to your muscles, to your fears and experiences. They are coded into that one cell. And you see now, the thing is, this sperm and this ovum, both of them have different experiences, right? They come together. The reason why they come together, why we don't divide like bacteria, is so that there can be variation. The bacteria just splits.
Yes.
So that this splitting, the daughter becomes like the parent. Absolutely. See? As the daughter does not become like the parent, because there's a sperm and an ovum that are coming together. But whatever experiences this X chromosome and the Y chromosome, they come and fuse into one. So I believe totally in epigenetics that whatever experiences we have now, whatever environment we create for ourselves right now, in future could be transmitted through genes.
And so does this mean that are we new people, or are we just a modification of our ancestors?
A modification of our ancestors.
We are not new people.
We are not new. And I remember the last time we spoke, I told you about this, and you will agree with me. Did you do an experiment? Because I asked you that observe some families who are thieves. They are kleptomaniacs. Like that pen, I'll put it in my pocket. Okay, it's not mine. Go back 2 generations. You'll be shocked one of the ancestors was a thief. That gene might have become recessive in maybe the father, the grandfather, but it is now manifesting in the child. That is, I have observed that and proven it.
So what is the place for correction? Like, tunaambiwa ati, some people argue that when a kid is born, they are a clean slate, right? As in they now become a product of their environment. So are you saying that if a kid is genetically wired, a kid can be born and they are genetically wired to be a thief?
Absolutely, and they will still, even when they have never seen anybody stealing, basically because of the genes. Where now what happens in progressive societies is that the environment, the rules of the land, overwhelm the genes. And that's what you see where we fail is enforcement of the laid down, code of conduct for our population. If you look at these countries, we've talked about Western countries. Look at Britain, for example. You see, for a long time, most vices in the society have been suppressed through very strong laws. Like stealing, you steal, used to be quartered and drawn and quartered. It was drawing and quartering. That means you are cut into two and, whatever it means, okay?
Yes.
Or guillotined.
Yes.
Over time, even this following of law and order becomes also part of the genes. But that is not to mean there are no thieves in Western countries. There are. But the laws are stronger. This is a society that has decided to follow the law. And this is a society that has been designed to be honest. So even if you're born with the genes for theft, then, where to express them becomes a problem. It's like having somebody who is very brilliant, but not going to school. There will be no expression of the brilliance.
So is that why people say most Kenyans are thieves, just the opportunity has not presented itself?
I think
we have a recessive robbery gene.
I don't think it's all Kenyans.
Most Kenyans. Because I've given an example where, for me, this has always been fascinating. Hii barabara ya Mai Mahiu, a lorry tips over. It's carrying mabati. Like, it is mabati, like, what the hell, mabati. And when it tipped over, people started looting the mabati. So that tells you, this person, there is no chance alikuwa na budget, alikuwa ati amepangia mabati leo.
None.
You understand?
Yes.
So how do you explain that? This was a thief minding his own business, and then an opportunity presented itself.
Yes.
So most Kenyans tuko na hiyo gene maybe.
I think, other than having the gene, I think some Kenyans, not most Kenyans, I won't say it's most Kenyans, we are also following the kind of examples that we see. And I would have to say, in the 80s and 90s, 80s, of course, I was mostly not there, so I might not know much. But what I hear is that professionals, for example, were satisfied with their salary. So if you are a doctor in Meru Teaching and Referral Hospital, you're only there, doing nothing else. If you're a teacher in Consolata Primary School, you're only there. Your salary is what you plan for.
Yes, that's true.
But nowadays, you will not get a professional satisfied with their salary.
That's an interesting area to explore.
Why? Because we've got an example. We have a group of people who can expand their salary the more they want. So there's also the national or collective psych, what I call collective psych. And the collective psych can only come from the top. Can only come from the top.
Yes.
And one of the cases I want neuroscientists to study is the Michoki rules.
Okay.
This is a guy who decided to lean from the top.
Yes.
He faced challenges, but he decided, we are going this, I'm sticking out my neck. Nowadays, I also get into matatos once in a while. Have you seen a matatu carrying more people than usual? Very rarely.
Rarely, yes. It was bad in the early 2000s.
Exactly.
Yes.
This guy established a culture, died, and the culture is self-propagating. Almost to the point of becoming genetic.
Yes.
That's the truth. That's the truth. So even honesty, being humble, being satisfied with what we have, somebody can actually set that example. Somebody can set that example. Helping or not looting, somebody can set an example. But to set that example, it don't be set by speaking. It has to be an example with consequences. So now, the new drivers of matatus and conductors, some of them were not there when Wachiko was there. But they
And they actually wear uniforms. I was
Yes.
surprised. I asked someone, and I'm ashamed to have asked this question. Yeah, bado makonda wa uvaa uniform, and it was like, wow, it actually complements what you've just said.
Yes. So
Resetting.
That national reset cannot start from below. It has to start from up.
Yeah.
So it's our national ethos. When you hear people say, we don't want to pay taxes because MPs will eat. And everybody in the village knows that even the person who does not know what a tax is.
Yes.
And they have believed you cannot remove them from there.
Yes.
How to solve that? Except to prove that they don't eat.
So now you've introduced a very interesting area, epigenetics. And I'm like, let's go to now education. You're a beneficiary of education, actually, 100%.
Yes.
The system.
Yes.
Now, what is your opinion on the people who say that the education system, me included, dumps people down? What's the difference between you and other people? On one side of the argument, people like you are outliers. Okay. What is your take in what would it take for it to be an equal opportunity platform?
I will say this. The CBC, if you allow me, or the CBE curriculum was actually intended to bring out the best in
everyone,
in people.
Yes.
For instance, why should I be a doctor if I would have been a better musician? Right?
Yes.
But the problem is the prevailing environment. How many people will break out as musicians or footballers? That a lot shapes the thinking of people.
Yes.
I'm sorry to say, but where we copied the curriculum looks to be a country where you can be anything you want to be.
Okay.
Most likely it's a first one country. I hear the Finnish. I have looked at the Finnish curriculum, almost resembles.
Yes.
A few other Scandinavian countries where the unemployment rate is 0%. When people are already well fed, when they are well housed, they don't need to become doctors, right? They can become musicians.
Yeah. Never thought of it like that.
Yes. So we are like comparing two societies, one that is trying to emerge, and people are still afraid of where they'll get their next meal, to a society where the government taxes 50-60% and they spends all of it on the same people to make sure they have housing, they have good transport, they have good healthcare.
Yes.
So, I mean, now when you come, I went to a certain school. I think Moi High School, Kabarak, one of actually the top student top school last year. When they were admitting grade 10, the pioneer class of the CBE curriculum.
Yes.
Almost all the STEM, I think they have 13, classes.
Yes.
Not streams for the grade 10.
Okay.
I think 12 or 13. Almost all of them are STEM. The one for arts and sports is only one. And even that is not full with students. Why? Because you are telling somebody to come play football in an environment of where there are no football academies.
Yes.
You don't know whether you get a club around. You don't know whether you make to the national team because, again, even our selection might not be, that well stimulated. It might be you are talented, but you'll not be chosen because you don't know who and who, right? But take the same and take it to Finland. I don't care whether you get a job or not. I know I have a house. I have a pension. I have good roads, okay? Then I would rather become what I want. You see the difference?
Yes,
we have
very big.
100 years to get there.
I agree, yes.
Yes, we have 100 years to get there.
So it's premature.
I would think so.
So, and why we changed it because we felt the 844 system was not working. So are you a proponent that the 844 served our economy better?
I agree. I think so. Absolutely, I agree so. The 844 has produced the best. Let's think, is it the 844 or is it our system, the way we run our country? What's the problem? What's the problem? And one of the things, and I'm sorry to digress, that I have a beef with the new curriculum is early specialization. Totally, I have a problem with that.
Early specialization.
Yes.
How so?
Because they are saying a kid who is 14 chooses to go into STEM, and this STEM is either computer, medicine, engineering. Because subjects that will take them to where? To there.
Yes.
Whereas us in the 844, up to the time you are selecting university, you could be anything. You could be anything. You could decide to be an MC, you could decide to be a footballer. That early specialization, to me, is a problem.
I think, in my opinion, I think early specialization has an advantage because look at an example. Like if someone was, I saw a video and I reference this a lot.
Yes.
Of a 4-year-old kids in China fixing electronics. And it was in a meme format. Then they shift to Kenyans, 20-year-olds doing TikTok videos dancing. If this, from experience, and I would call it apprenticeship, okay? And early specialization would be, let me actually break down the example. Useme, someone starts mentorship ya carpentry from as early as 7 years old. If this person becomes handy with this work, by the time they reach 18 and they've mastered this craft, the kind of furniture this person would never lack in terms of, first of all, no one who, if they've been consistent, no one who has gone to a polytechnic to start doing furniture has anything on them. You can't beat that.
Absolutely,
you can't beat the time that has been invested in training.
Yes.
So my opinion would be early specialization, but data driven. In this sense, like what are the needs in this country in X period of time, right? So children around this age, we need to know a balance in terms of support for the economy. Like we'll have, let's say, doctors is square open season at just because you got an A, you go study medicine.
Absolutely.
What's the need for doctors at a certain, in this projected period? What's the need for engineers? What's the need for and the Bureau of Standard has this data in terms of what would spark economic growth.
Yes.
But early specialization for me would make sense, but from this perspective, like start mentoring students who actually have the qualities of becoming good doctors from as early as even primary school.
See, let me say, instead of changing the curriculum, it is the country we should have changed first. That's my thinking. Because
yes.
Okay, let's say you are a good carpenter. How far will you go with carpentry? Who are the richest carpenters in Kenya? Not unless you get a job as a contractor, maybe to supply government offices. And to get that job to supply government offices, you need some connections, which might not even be based on merit. So already we are starting from, a slate where this carpenter will be practicing where they are already disadvantaged. To me, broad education allows, by the time you're reaching 18, you're finishing Form 4, you can choose from a number of areas. You can even choose your area and a talent. You can even follow a dual, what they call a major and a minor. So that broad, being broad is good.
Okay.
And that's what you see, which is the most developed economy in the world.
America, Britain.
America, right? There is nothing like early specialization in America. They do pretty much everything. Look at these guys, the top billionaires. You hear he studied liberal arts. And then as he is studying liberal arts, he is developing a computer in the garage. Right? How did he make to become top? It is because the environment allows him to innovate. When he establishes an industry there, he is able to see these 2, 3, 4, 5 donors. These guys who can, expose his idea. This government that supports him, right? Do you think in Kenya we have shortage of innovators?
No, we don't.
We have very many. And most of them have gone through the 844. But when you think of innovation, you think at the prevailing environment, who will come down upon you and you say, watch a guy. Let me become a teacher.
Okay. You settle for what's available.
Absolutely.
Okay.
So we have a long way to go as a country. I think, to me, changing an education system will not be a solution to our problems as a country.
We need to change ourselves, Kwanzaa.
We need to change ourselves. How we consider merit,
Yes.
what we consider important as a nation. And again,
Yes.
I'll say that this has to start from the top. Yes.
Aya, so now two things before we finish. Kuna kitu nilikuwa nimemaka hapa kwa kitabu.
Yes.
And I wish ningekuwa na detail. By the way, your story about Dr. Ribeiro, sometimes I confuse the pronunciation. That's the correct one.
Yes, Ribeiro, yes.
It's very, very interesting because hapa, wale wanataka kujua how Nairobi really started, by the way. I don't think you can even Google this. Don't Google. Just go get the book. Yeah, Escort in Chief. We have a link in the description to Nuria store. So click to inakupeleka and they can deliver to any part of the country to your doorstep. Watakuletea. So the contribution ya Dr. Ribeiro, and it was interesting that when you explained the story, and I think unajua kuna watu wamekuwa wakifikiria Somalis are visitors in Kenya, and this is now the third book naona how far the Somalis go in terms of being a community in Kenya.
Yes.
In 1900s.
Yes, that was 1904, 1903.
Yes. Hapa naona the decision by the British Railways engineers to establish a depot for their supplies during the construction or hiyo ni establishment ya foundation. Delivery was done. By the nimeona where history the culture when the doctor observed that people by what they believed in, people used to die because, for example, mtu anahitaji special attention during childbirth, and culture says they should not be handled by men, delivery is only by women, and they die.
Yes.
Alafu inakuwa, that's the will of the Lord.
Yes.
What is your line hapo between the will of God and this could have been prevented? Is there anything like preventable death?
Yes, of course. Preventable mortalities are there. Although I'm saying, of course, I started by saying physicians, we don't prevent death. I said we postpone death to the right time. Like if a mother is delivering and bleeds to death, gets postpartum hemorrhage, that's a preventable death. If somebody dies of malaria, you could have prevented the malaria. If somebody there's a mass accident, maybe with better speed it could have been prevented.
Yes.
But it is true, even now, we have communities where culture still causes a lot of preventable deaths. For example, if there is FGM and it messes up the birth canal and during delivery there is bleeding, or there is prolonged labor and bleeding, that is a preventable death. And in fact, the writings of Dr. Ribeiro, which are which were serialized in the British Medical Journal of 1954, all his writings were serialized there. He talks a lot about the communities in Kenya and the cultural aspects of medicine. Remember, even if it was early, Nairobi was a boiling pot of kind of a melting point of all the cultures in Kenya.
Yes.
And of course, he was the first he was the first doctor to establish a private practice, in Nairobi. So, for me, I like looking at things from a historical perspective because unless we know where we are coming from, we cannot know where we are going.
Yes.
And I usually have beef with Christians, and I'm a Christian, because Christians don't understand history. I like the Muslim perspective on history. That if you go one-on-one with a Muslim, they can tell you even the dates when Muhammad left Mecca for Medina. They'll tell you all the important happenings, all the the Rashidun and the Al-Ansar. They'll tell you very well. But for us, we pick from here and we only look to heaven. So the other day, I even had an argument with guys who wanted, when I told them how the Anglican Church started.
Yes.
It started out of a king who wanted to marry a second wife, and the Pope refused. No. It was divine inspiration. No, please. It was not divine inspiration.
Yes.
This guy wanted another wife. He's already married. The Pope refused. That grant birthed the church. So me, I like looking at things from that historical perspective as a way of laying a foundation so that we can launch into the future. Yes.
So now I believe Amina's mom, because I believe the story is here in the book, and you have expressly said that the people mentioned gave permission to be mentioned.
Yes.
And I believe Amina's mom in the book is the first patient the first time you as a doctor you deal with a patient dying.
Yes.
Sindio?
No, it's not my first experience.
It wasn't the first?
It was not my first
I don't know why I
experience.
got the impression that it was the
It
first.
was not the first, but
it was unexpected.
it was unexpected. Death came out of the blues, basically.
Yes,
you
that's
know,
a chapter.
like I can say, let me, you have a finger that is hurting, it has some pulse, let me press, and then you die.
Yes.
You know, I mean,
Yes,
no one would have expected that.
Yes.
So it was unexpected. So that hits hard. Sometimes we know when we are taking a patient for this procedure, the way they look, they might come out or not come out. And we even tell relatives, it is a 50-50 situation, right?
Yes.
You start preparing relatives. But when you're going to draw blood or just from the bone marrow and the patient doesn't wake up, you cannot even begin to explain. What?
Did you ever make sense of that? Because hiyo ilinishtua. That shocked me. There are two stories nimesoma hapa nimerudi nikaka noma. That and that story of Jane. That is how this book is written. By the way, kila mtu aende tu atafute. Tumeweka link hapa kwa description. Mama Amina's story and the story of Jane, who you ulimpatia story how mpaka boyfriend yake akamwacha, that whole journey, right?
Yes.
But specifically ya Mama Amina, did you ever make sense of what happened?
I might have a clue of what happened, but a postmortem would have worked, although they refused one. And that's why postmortems are very important. Yeah? In some countries, actually, every death must be followed by a postmortem.
Yes.
It is very important
Yes.
because postmortems then inform what is happening so that it is prevented next time.
Okay.
But we know extreme pain or even anxiety of a procedure can cause a heart attack. That is known.
Oh, yeah.
Some chemicals or some drugs can react. Even the drug you put for numbing pain can seep into the circulation and maybe react to the patient and cause a heart attack. Possibly that's what might have happened.
Yes.
But now there is no way of knowing beforehand that this will happen. After all, you're in a hospital.
Yes. So
Yes.
now, with the experiences that you have written and what you have gone through, what is your, I believe the correct word is, what is your assessment of life and death?
My assessment is that death,
Yes.
of course, and this is known that death is a guarantee. It can come unexpectedly. So, there's no need to obsess over it. Any obsession with death is dangerous.
Yes.
Because it's not anything. You can say you are well guarded. I see people going and doing everything. They work with body guns. They eat well. They carry guns. It will still. There's a story. If you allow me 2 minutes,
Please do.
My grandmother used to tell me. It's a Meru cultural story.
You credit her as storytelling. Sir.
Yes. And she told me this story, and I find it very poignant. Yeah, about this boy who was being born by a family that did not have a boy child for many years. They had many girls, and then they got a boy. And the father was just pacing around as the boy was being born in the hut. And then he heard a sound saying that even if this boy is being born, he will be killed by a rhino. Okay?
Yes.
And so he said, no, the rhino can't kill my only son. So this boy grew up within the homestead. The homestead was well guarded by warriors. And he was not allowed to go out of the homestead because of the fear that he would be killed by a rhino. Then one day, out of nowhere, a rhino came running and launching around the homestead. Of course, the warriors speared it to death. And the elders were called and told, there was this saying about this boy, and now the rhino was almost coming, only that it was killed. And the elders said, the way to remove this curse is to have this boy, the rhino's head cut off, and let him go around the hand 7 times. As he was going around the hand, he slipped and fell on the horn. And and he was, pricked, the abdomen, and he died. So that's about death. That's about
So
death.
even if they killed the rhino.
Yes, it is still killed the man. Yeah.
Bana. So you can't leave us with just one grandmother story because that is powerful. And ulisema hapa, her storytelling ilifanya is what influences your storytelling.
Yes.
Tupatie story ingine moja yenye kama hiyo yenye by the touched your life, and I hope I'm not putting you on the spot. Something that comes to mind yenye alikufundisha that carries lessons to date?
Many mysteries. Actually, I'm writing a novel, and a number of her stories, are going to come.
Yes.
She's told me stories about the Mau Mau, actual encounters with the Mau Mau.
Yes.
Stories about witchcraft and how it influenced our lives. One particular story I remember is one morning. I don't know how true it was, but one morning she left with her aunt to go to the farm to do weeding.
Yes.
Before dawn, when the cock crows.
Yes.
And they left and they were going quite some distance. And just when the dawn cracks and you can see from a distance, they saw somebody, drawing some lines on the path.
Yes.
And when they got to the place, the person had disappeared. But for her, because she was young, she started crossing the lines. And her aunt pulled her back, but in the process of pulling her back, also crossed some lines.
Yes.
Only for her to realize later that somebody was actually laying some kind of charms. So the aunt died, and she got critically ill. And that's just how powerful. I don't know whether it is true, but that's just how powerful, witchcraft was among the Meru. That somebody could draw lines and you cross them, and you die.
Now that at some point you mentioned that Africans believe in interesting spiritual situation.
Yes.
What do you think? Do you think it's real?
I think it could be real. I think it could be real. The spiritual realm is true. The spiritual realm is true. Even some heritages, and this also comes from my grandmother, some heritages run in families. I remember when I went to medical school, she was alive and quite strong in 2005.
Yes.
And I came and explained to her that I was going to become a doctor. And she was not learned, so I had to explain what being a doctor means. She told me, actually, this is a family heritage. So I asked her how. She told me, don't you know, in your family line, your great-grandfather was a doctor from the paternal side. From the maternal side, the great-grandfather was also a doctor. How? This one was a doctor who used to diagnose. In the traditional Meru, if you had somebody who was coughing, like they have some cough, you go to somebody who will do everything and tell you the problem is this, but they never give you anything. Then they will send you to somebody else who knows the various herbs and concoctions to mix and they treat you. That one is a scientist, the other one is a doctor. And it so happened that my brother is a scientist, I'm a doctor. And this gene grew recessive in between. And then it came up. It skipped 2 generations, my grandfather and our parents. Then it grew up in us. That's family heritage.
Wow.
Even you, look at your family, the craft you do. Go back, you might be surprised that some great-grandfathers used to do the same.
It's interesting that I had a conversation with my father, and my memory serves me well. My grandfather used to play the wandindi. In Kijaluo inaitwa Orutu. He used to play that very well. And now, in retrospect, I was like, if I knew what I know now, I would have wanted to know what the skill is. So now, I have a conversation with my dad about what he would have wanted to become. And he says that he wanted to be a musician, but my grandfather called him, akamwambia, it doesn't end well for musicians, so put that guitar down and focus on a skill. So now, this is a story he told me recently. So now, in retrospect, when I started out, I wanted to be a musician, not knowing any of this.
Any of the connections.
Yes.
That's
but I learned
in the spiritual realm.
But I come to learn that my grandfather was actually a legit musician.
Yes.
Back in his time.
Yes. So these spiritual things maybe have a way of manifesting down generations. Also that's the same for curses. We know African curses. If a father cursed a son, it would go down generations. It is also in the Bible.
So, 2 things. Yani, Due time,
Yes.
there is so many things I would have wanted to cover in this book, but because our audience ni watu wa janja ni watu wa smart, they can grab a copy and then nikifanya review we can compare notes. What did I pick? What did you pick? Escort in chief, a link iko hapa kwa description. So 2 things.
Yes.
Number 1, we discussed Einstein. I would like to go back to
Albert
Einstein,
yes.
The brain and the formation of a genius. But also now, in your experience as a doctor,
Yes.
Patients, wakati someone is nearing life, there's something that you write of ni ile some kind of hope. Like someone who's very critically ill, alafu all of a sudden they get well. People in the medical profession knows huyu siku yake imefika. What's going on there?
In the medical profession, we call that terminal lucidity.
Yes, that's the term niliona hapo.
Terminal lucidity means somebody was confused, was very sick, was not eating, and then all of a sudden they wake up.
They get energy.
They get energy, start greeting everyone. They say, we are almost getting discharged.
Yes.
That sometimes precedes a death. It's mentioned, it's described very well in the medical literature and even in the African society. In fact, my grandmother used to tell me, if somebody is very sick and then they have not been eating, then they wake up and tell, I'm feeling well now, give me water. You can be almost sure that this person is dying.
My aunt, that happened to my aunt. She was very sick. Alafu kidogo at some point akapona mpaka akaenda akatembea akazunguka places you never imagine. The next day she was gone.
Yes. There is that that happens. Of course, it has to do with some physiologic changes in the body, but yes, it is well described. Yes.
Okay. So now hapo kwa Einstein, we were discussing the brain.
Yes.
Is it possible for someone to control how their brain develops? Kama when I told these kids at this school that if they can control their sleeping pattern, they could actually control how they can actually influence better academic performance.
It's true.
Is there truth to that?
Absolutely, yes, there is. The brain develops, of course, even if we are talking of genetics, the environment is very, very important.
Yes.
If I had to put it, I would put it at 70-30. The environment takes 70% of brain development and how much the brain expands.
Nature and
Nurture, yes. So nurture is extremely, extremely important. So the kind of environment that, the brain develops is very, very important. The kind of experiences, the kind of attitude they see, the kind of example, the kind of books they read, the kind of rest they have, the kind of hobbies, whether they sleep enough or not. That all those, kind of open up or close in the brain. And I think we discussed that when a lady wrote to Einstein about a child who wanted to become a scientist like him. And they told them, the lady wanted to know which books should my child read. And he said, let her read storybooks. Many storybooks.
Yes.
These are not scientific books. He said, storybooks will open up the brain. Now, anything else can get there. So yes, it is possible to control brain development.
Okay.
Yes.
Asante sana, Doc.
Yes.
Asante sana. This is a very well written book.
Thank you.
We can't wait to hear your grandmother's stories.
Absolutely. A novel is coming up.
Yes.
It will have those stories.
Yes.
Although they might not be like this from my grandmother, maybe through other characters.
Yes.
But we have to immortalize her in that way.
Yes. We really do appreciate you making time for us. We are so humbled that you traveled so that we could actually make this happen. Very, very much appreciated. Looking forward, I believe our audience will pick several things from our conversation, and we hope siku ingine tena tukikutime, kwa sababu I also recognize that tukikaa hapa kukupata on a weekday means a lot of sacrifice. So siku ingine tena tukikutime, we hope tutakuwa tumeprepare more good vibes, and our audience pia wanaweza suggest any other areas they would like for us to cover.
Thank you.
Asante sana.
Thank you, and great job you're doing.
Thank you, sir.
Keep up. This is building the nation and opening spaces for many other people.
Asante.
Keep it up.
Thank you.
Yes.
Aye.
Yeah.